Welcome to Amplify by Silicon Slopes Commons. Today we are joined by Dr. Mark Harrison, Mayor Erin Mendenhall, and Connie Washington, as well as Ross Romero, our moderator for today. We are going to be discussing racism, healthcare, and how we can fuse those two things to make our state a little bit better. Ross, I'll let you take it away.
Thank you very much. And we really appreciate Amplify and Silicon Slopes giving us this opportunity to have this community conversation. And thank you for joining us. By way of background, my name is Ross Romero, and I am the CEO and principal of a consulting business called Inclusion Strategies. And I focus on diversity, equity, and inclusion, as well as government relations consulting. And I'm very glad to see the conversation that's been occurring in our state relative to making sure we are inclusive and inviting. And I'll also say, relative to this topic, I do serve on the board of the Utah Hospital Association. So with that, let's let our other panelists introduce themselves. Maybe let's start first with the mayor.
Well, thank you for having me today, and I'm happy to be here with the other panelists. I'm Erin Mendenhall, Mayor of Salt Lake City. I'm the 36th mayor of our capital city, and couldn't desire to be in elected office at a better time, at a more poignant time in at least my lifetime, where people who ran for office for change are in the best possible position to actually make those changes happen. And I'm grateful to be in this role at this time and to be working with our communities here in Salt Lake City to unpack and build anew the systems that have been really, they're not broken, they're doing what they were built to do. And unfortunately, many of those systems were built to serve some people much better than others. So that is the work before us, and the healthcare aspect of racism and equity is a very important conversation. So thank you for bringing it to this level and for inviting me to be a part of the dialogue today.
Yes, and thank you for your leadership. Connie, how about yourself?
There it is. Hi, my name is Connie Washington. I'm Senior Director of People Operations and Diversity at Progressive Leasing. I appreciate the opportunity to be a part of this as well, and I am thrilled that we're having conversations about these types of issues. I'm a born and bred Utahn, grew up down in the Rose Park area, went to West High, so I've been here most of my life. I've left and come back a couple of times because it's just a great place to be, and so I want to be here and continue to see the change that's occurring. But as the mayor mentioned, it is so refreshing to be having these conversations out in the open and be invited to talk about some of these things that haven't been addressed in the past, and to work on lifting up those people that perhaps have not had the support and the assistance that they've needed in order to live their best lives here in the great state of Utah. So excited to be a part of this and to be a part of the conversation.
Thank you. And Dr. Harrison, please.
Hi. Well, thank you very much. It's a privilege to be a part of this panel. I'm Mark Harrison, and I'm President and CEO of Intermountain Healthcare. I'm a pediatric ICU doctor by training and trade, and in fact was trained at Primary Children's starting in 1990. And I guess I was a slow learner because I didn't finish my training until 97, or maybe there was a lot to learn. Then we were gone for about 20 years and came back here in 2016, and I've been in role for about the last 5 years. Equity has always been a passion of mine, and I think, I really like what the mayor said. This is a privilege to lead in this particular time, and for all the reasons she said, plus in my work, the pandemic has added a really fine point to the issues of diversity, equity, and inclusion, and I wouldn't have made this circumstance, but I sure am glad to get to lead in it and try and make substantive and lasting change for the people we serve, all the people we serve.
Thank you. Critical. And let's stick with you for the first question, Dr. Harrison. Intermountain, along with other Utah health systems, stated earlier this year that they believe racism is a public health crisis. What drove that decision for Intermountain, and what do you hope comes out of this effort?
So, Ross, the way that's framed, the way we stated it, and it's true, makes it sound very political. For me, this is primarily a clinical issue. Now, there's political context to it, there's sociologic context, and I respect that and admire the people who are working on that. It was really very easy for us. One of our great intensivists working at Intermountain Medical Center, soon after the pandemic started, she gave me a call and she said, Mark, I'm not an epidemiologist, but everybody in our ICU is Black or brown right now. And she said, I know that the population is not proportionate to what I'm seeing clinically. And it put a fine point on what we've known is true for a really long time. And it has provided us with a context to not just provide equal care, which by and large, I think we generally do, but really drive hard towards equitable outcomes. And that opens up this whole can of very interesting conversations about how we achieve those. And it's much more complicated than what antibiotic you use or what kind of ventilator is in your ICU. It's much more around the social determinants of health and all the other things that lead to a person's health and well-being. So that's where we are. I think I'm proud to work with the other health systems here in Utah. And although we compete at times, one of the beauties of the pandemic is that we have really become close colleagues and arm in arm in trying to address things like racism.
Thank you. And let's just stop there for a minute, because I think that's really important in the context of these conversations, whether it's around critical race theory, which is also very actively being debated in the community, or I would say the loaded term of racism, because I think that tends to put people on a defensive unnecessarily. And what we're really talking about is the observable differences that are occurring as to individuals' outcomes and opportunities. And if race overlays that, it's important to look at why that is and how that can be addressed. I would say the same things are occurring, particularly in certain professions around gender, right? Historically, people have not been included. And all of these efforts are really just meant to have us observe some community challenges and then work towards community solutions. So, we decided purposely to change the topic of this to addressing health disparities, because we wanted more people to be in this conversation about being part of it and not be as concerned about, the label that certainly indicates race is one of the factors with healthcare disparities. And we'll get into social determinants of health that are wrapped up in that in a bit. But let me say, in this context, we also had Salt Lake City with its leadership and the council also expressing sentiment that race was an observable differentiator with healthcare outcomes. And the city signed a pledge to that same sentiment. So maybe the mayor, could you tell us how you came to that conversation and why the city cares about addressing this?
Sure. The idea for the resolution came to my team from a group of community leaders, some of them students at universities, others in health-related careers are working toward that. And we brought the concept to our city's Human Rights Coalition and our Commission on Racial Equity and Policing. They fully supported it. So I advanced it to the city council. And as you said, it passed as a resolution. But it's important for us as a city to make that kind of a declaration, to publicly acknowledge the existence of grave inequities that so many in our community have known and experienced for lifetimes and generations. And in doing so, committing ourselves to the creation of policies and ordinances that are anti-racist, that are proactively anti-racist. because structural and interpersonal racism are proven to have detrimental impacts on the mental and physical health of communities of color. And it directly impacts their access to many different everyday resources like education and housing, employment, and healthcare. And there's these cascading effects that happen when access to those resources is limited. And that's known to result in negative cognitive outcomes for physical and mental health across age ranges. I'm not the doctor on the panel, but I appreciate Dr. Harrison nodding along. So as the most localized sort of level from the federal down to the local government, we have a lot of tools in our box that can help impact these access to the resources that are needed, from housing that's affordable, transportation that helps people connect to jobs and education, after school programming, community voices helping influence and shape the policies and the funding that a city does. So I think it's an important step. It doesn't change anything by just making that declaration, but it states publicly that we are completely committed to doing this work and asking the community to help us heal and grow in a better direction.
And thank you for that background. It really underlays what has been some of the challenge for these important conversations, right? Historically, we have had codified laws that discriminated, right? It used to be permissible to redline. People of different ethnicities weren't able to marry. Same-sex couples weren't able to marry. So the fact that we are in this time of change and of progress, it really is important to have these conversations and to know that we just have work to do, right? Right now in this community conversation, we're talking a lot about unconscious bias. I think people don't want to think they're biased in any way. And yet when we take a minute and think about who our social networks are and who are our friends and who we socialize with, we realize that we're maybe not as inclusive as we could be. And that's really what we're talking about. So understanding that history, I think, is very important. So thank you, Mayor, for bringing that out. Connie, can you tell us a little bit about what Progressive Leasing is doing? Obviously, this is a tech community conversation, and we're all resources together, whether it be the hospitals or local government. But what is the tech community doing, and what is Progressive Leasing doing?
Sure. Well, what we're doing, we've endeavored to advance our, diversity, equity, inclusion, belonging initiatives. And it's interesting. Right before this call, I was on a call with our employee resource groups executive sponsors. We've in the last year, we've initiated 4 employee resource groups. The Black inclusion groups for our Black employees, Pride for our LGBTQ+, Latinx for our Latino community, and WILL for women in leadership. So I was just talking to our executives about the importance, and I told them I was going to be on this call, the importance of what we're doing, and that they advocate for our marginalized employees who don't get the representation, who don't get the opportunities potentially within our organization. So we're starting those initiatives like the employee resource groups. Our open enrollment is coming up actually with benefits. So it's interesting to be talking about this because we're trying to determine how we can better educate our employees. While we are a Utah-based organization, we have employees all over the country. So somebody may live in Mississippi, in Alabama, in Georgia, in New York, in New Jersey. And are we providing the resources that they need to find the providers, to get the preventative care, to educate them on making sure that they do that and why it's important? That perhaps if you get that mammogram now, it can prevent breast cancer in 5 years that could, have a much more detrimental effect. But it's our responsibility. We provide the benefit package and the benefit for them to utilize. We have to help educate them. We have a very young demographic, so making sure that they understand what they have the benefits of those benefits and help guide them. And so we're partnering with our brokers, our providers that we work with. I was on a call with them last week talking about the same thing, and they've got an initiative. It was their all-employee meeting, and part of the other half of the conversation was on health equity. And so that's who we want to partner with, is people who make it a priority, that it is important to them because it's important to us. So that's some of the things that I think employers can do to help bridge the gap and help. It's education. If people don't know and understand, they won't do it. So we've got to be the ones to help educate them on what they have and what they can be doing.
I think that's critical. I was speaking today earlier at a SHRM conference, Society of Human Resource Professionals, and understanding the critical role they play in people, right? And in culture and in workplace and benefits, and understanding how there are differentiations in certain diseases that affect communities of color more than others, as a for instance, right? And so how do we make sure that those illnesses and prescriptions are covered under plans to make sure that they're getting the benefit of their workplace? Let me ask Dr. Harrison again. He's really the expert in this space. And Intermountain announced its own equity initiatives recently. And I wanted to try to understand, how come you elevated the work of DEI as a fundamental core value, and how you are making sure that's being executed for your hospital system, and maybe, if, relative to other hospital systems?
Well, first of all, this isn't a race, so we're not as competitive as I am. I'm not trying to beat another system.
Yes.
I'm just we're trying to do the right thing. I'll tell you that the way things work at Intermountain, we're a very data-driven organization. We're a very goal-oriented organization, and we accomplish the things we set out in front of us. We have an annual process where collaboratively we decide what we're going to work on. Those goals are actually built around fundamentals: safety, quality, experience, access, stewardship, and now equity. And I knew that I could assure that we would work on this day in, day out across the entire organization by including this as a fundamental. Was this easy to get done? No. And in fact, there were a number of folks who thought this was a big mistake. It's interesting, a year and a half later, it's as if it has always been. And that's actually really gratifying. And I think, leadership opportunities don't come when things are good. Leadership opportunities come when things are tough. And I'm really proud about how we've incorporated the work of equity into everything we do: how we hire, how we educate, whether it's anti-racism or inclusiveness training. For us as an organization, are our members at Select Health, the 1 million members, are they treated equitably? For the patients that we're privileged to care for, we touch half of Utahns every year, and now hundreds of thousands of folks in Nevada and Idaho as well. Is our work delivering equitable outcomes? And a great example of that is one of our leaders in women's health. When he started to read about inequitable outcomes amongst pregnant women based on the color of their skin, he thought to himself, we surely won't have that at Intermountain. But guess what? When he looked at our data, we did. And now we're working at it day in, day out, chipping away at it. There's no magic bullets to any of this. But our 45,000 strong people, when we put our minds to something together, we get it done and we do it right. And that's what I'm seeing our folks doing every day now.
I appreciate that. And maybe one of the specifics you're mentioning are the care African-American women get as they are having babies and they're in that setting. I know
yes, I'll be very specific. Black women are more likely to die in childbirth or have serious complications of childbirth than white women. I will say, Ross, one of the things I really do worry about, and I care deeply about look, when I took a Hippocratic oath, it wasn't just for white people, or wasn't just for straight people, or whatever. It was for all people. I think there are significant disparities that are occurring amongst our rural poor also, and amongst poor white people as well. And I think we need to be careful that we ourselves don't get into an echo chamber and put very narrow definitions around what equity looks like. So I think this is really for all people. And I hear that in Connie's words and the mayor's words as well. So I think we're very much on the same page. But for those who are listening, this is a human agenda. This is not a color-based agenda in my mind.
Yeah, I think that's really important to underscore. And in fact, as you know, the Utah Hospital Association takes seriously the treatment and care of our fellow Utahns in rural communities.
Yes.
And they're very much at the table. In fact, the current board chair is from a rural system. And so you're absolutely right. And understand, critical care is needed sometimes. And so there's transfers that are going on. But this really, speaks to that question: why are certain women with a demographic and with an ethnicity experiencing child death and mother's death at a higher rate? And so understanding that helps us to then focus on being better. And that's really what this is all about. Maybe to the mayor, Salt Lake City's West Side experienced greater numbers during COVID of exposure. And there was, I guess, now we've learned resource challenges that have been corrected. But maybe could you speak to what the city's doing relative to following, needs assessment for healthcare disparities in the city, and how have you addressed those?
Sure. I want to just start from where Dr. Harrison was leaving off, that and invite people listening who might, have questions about really how's this really impacting Utahns? Is this really an issue in Utah? That the Kempsey Gardner Policy Institute with the University of Utah just a couple of months ago published this data book on diversity in Utah, race, ethnicity, and sex. And May 6th was the date. It's free. You can check it out. And it doesn't come to conclusions about why these inequities are there, but just how does it play out? Check it out and go on to page 3, and you can look at life expectancy, owner-occupied housing, higher educational achievements, math proficiency of youth, and it breaks it out by male, female, and then different races and ethnicities. And it paints a pretty clear data picture of what we have to work with, what we must work with here. We know that this was made extra clear during the pandemic. And at the height of it, odds of being infected with COVID-19 were 3 times more likely in Glendale. In our northwest part of Salt Lake City, they were 2 times more likely in Rose Park. And that's where there are higher percentages of our Latino and non-white residents. Even though Latino communities in Utah are only about 14% of the population, 40% of the state's COVID cases were Latino. And American Indian and Alaska Native communities in Utah had a case fatality rate that is about 3 times higher than the state's average. So just even most recently with our pandemic brings painfully to light what a lack of access can cause. So that's from inadequate information with a really fast evolving virus. It's healthcare, it's testing, it's trust in these systems, it's transportation to a clinic, it's having childcare for sick parents and caregivers. And those outcomes can be catastrophic in a community. So it's not good enough. It shouldn't be good enough for any city government if only some of the members of the community get to experience a high quality of life and health, and others are running into these barriers in almost any direction they turn. But that's what we see with a lot of our communities of color. And due to those inequities across the board, they're facing these negative physical and mental health outcomes on top of everything else. So I want every person in our city to be able to thrive, like Connie said, to be able to live their best life. And whether that's the bad air quality that we experience during our winter times and now summertime, unfortunately, or the systems that are perpetuating oppression, I think we all need to be working to make these improvements. And cities invest in spaces all the time that increase access to jobs, increase access to recreation or exercise, or access to healthy foods, or socializing, and improving connectivity between communities. That's a normal thing for cities to invest in to lead to happier and healthier outcomes for our people. And Ross, I really appreciate you bringing up redlining. I keep that map of Salt Lake City right here next to my desk, redlining map that's at the University of Utah Library. And that racist investment strategy or lack of investment is a tangible and pretty recent root of the disparity. It was a denial of private investment to poorer parts of cities across the country, which also was often the only place that people of color could legally buy and invest. And even looking into the bylaws of neighborhoods that we live in Salt Lake City today, many of them prohibited people of color from owning a home in those neighborhoods. And we don't even know this history just a couple of decades removed. So over time, these areas of the city fell way behind the rest of the city in private investment and in personal capital, that wealth and ownership of individuals and families. Infrastructure fell behind. And for most of our history, these communities of color have lacked an equal voice in decision-making and city budgets. So I could go on about the ways that the city is actively working to undo these systemic barriers that were intentionally put in place across our country and right here in Utah as well, and that they're still predictive of the outcomes of our residents, from graduation rates to infant health, healthcare access, fresh food access, proximity to transit centers that connect to jobs. Those red lines are alive and well, unfortunately, in this city and in cities across the country. And it's by having these kind of conversations publicly and owning it that we can start to make decisions together with our community to change it.
I appreciate that. And people will notice that people have different life expectancy depending upon where they live and what zip code they have. Let me ask you a question, Connie. So one of the ways that people have better health outcomes is by having a job, right? If you have a job, you're more likely to have insurance, reliable transportation, access to quality care. So as an employer, I guess I wanted to understand from you, what is Progressive doing and other companies, because you're in this HR world, doing to make sure that unconscious bias isn't seeping in at the hiring stage? Because, if individuals can't even get in the door, then they're not given a lot of opportunities that come and a lot of benefits that come from employment. So what is the tech community doing to prevent unconscious bias and to work on this?
Great question. I just want to go back to the mayor one moment briefly, because something she brought up hit home for me, because I grew up in Rose Park. When my parents purchased their home in 1960, the neighbors signed a petition for them not to be allowed to buy that home, which was $14,000 back then. That's what the home cost. But that just, she knows that now in 2021 as the mayor of Salt Lake. Wasn't here then, but I have firsthand experience of them telling us. And they said some not so kind words, but I'll be darned if I'm going to let somebody not allow me to buy a home. But you're so right. That's right. That's the history that people are kind of shocked. A few years before I was born, that's what they faced. But they, rather than to back down and go somewhere else where somebody thought they belonged, they stood their ground, maybe got some side eyes from the neighbors, maybe had a few people say some not so kind things to them. But that's what it has taken to get here. and we thought we were further along than we are, but we're getting there. But so anyway, back to, I just wanted to call that out because it was just interesting that that's something that she spoke about that is we have personal experience in. So what are employers doing to negate the bias? I think it's a work in progress. I think that the events of the last year and a half that happened last year that really brought this to the forefront, the things that we all watched on our television, woke people up to what's happening. And then voices got louder and louder to the experience of underrepresented individuals. So I think it's baby steps. It's looking at your assessments and looking at how you assess and if there's ways to remove the potential for the bias, as well as training people that it happens, that you have bias. Don't pretend you don't, you have it. So we're training our leaders, we're training our managers, our recruiters to recognize that they have it so that it isn't part of the decision-making. But then we're also intentionally looking for those diverse candidates. We did a partnership with Howard University and the University of Utah, a historically Black college, Howard in Washington, D.C. We connected with them through the University of Utah, brought on an intern that we recently hired full-time. Had we not had that relationship, we would have missed that talent. And he's an engineer. So he didn't know much about Utah. We didn't know much about Howard. Well, I did, but many others didn't. But by getting those connections based on, I kind of think how we have woken up, we're starting to broaden our horizons and look for talent in multiple places, as well as identifying the talent that's local, by connecting with the universities and again, looking for the talent that everybody else may not be interested in. Our employee resource groups are going to help us in helping us get out there and identify these people that are not getting the opportunities to come to work in a technology company. And we're a little different. We have contact center employees as well as technology. So we're filling a multiplicity of positions, and it's very, very, very hard right now in Utah. We have a space in Arizona that we're trying to do more recruiting because there's not as much competition as there is here with the Silicon Slopes. There's just, everybody's looking for talent. But we're being creative and we're collaborating with and thinking outside of the box as we're looking for individuals, because we can't do what we've been doing because we'll get the same result, and that's not going to work anymore. So it's a work in progress, but we are intentionally looking for ways to find those people, that talent that is out there. It's just been missed because of the systemic racism that exists and the biases and all those other things. So again, that's why this is so important to have these conversations, to get it out in the open and recognize the issue so we can address it.
Let me invite the panelists. We've had a bit of discussion already. Is there anything anyone wants to say that maybe they haven't said or echo sentiments expressed? Yes.
I guess I'd love to ask the three of you. By the way, Connie, I really agree with what you just said about how do we have these conversations. I think Aaron got at this as well. I think the risk is that if we don't do it skillfully, people feel accused. And when they feel accused, they become defensive and they harden their positions. And in fact, it can make things worse than they were before, and even drive things underground where it's actually harder to take care of them. So I guess I'd be interested in the wisdom of you all, from your experiences. How do you actually raise this question in a way that doesn't stiffen people's spines in a negative way?
I think it's important to make it safe to have the conversations. Up until maybe a year and a half ago in the workplace, people didn't talk about this kind of stuff. Like, no, HR was like, no, don't go there. Like, let's go somewhere else. But now it's here. It exists. Why not talk about it? I invite folks that I interact with to ask me the question. And some of them are like, well, I don't want to ask because I feel like it'll be dumb. Well, you're not going to know if you don't ask. So you're safe. Ask me the question. Well, do you straighten your hair? No, not anymore. Well, when you get braids, the different things that they want to ask, but they don't know how to ask. So I think we have to do a better job of creating safety to ask the question, to have a dialogue so people can learn. And I've done I've had conversations with some legal groups and difference, and they're all so paranoid. Like, I don't know how to ask, and I don't want to offend you, and I don't want to sound stupid, and I don't want to, and all the I don't want is, and I get it, but I feel like these kind of conversations are helping to just, ease the stress of having a difficult conversation, because we're humans, and I am different. My hair's different than Erin's, and my skin color is different than yours. And okay, so let's talk about it. At the end of the day, peel it off, and we're all the exact same. But I've got some different experiences that you may not be aware of. Let's talk about it so you can understand my experience and potentially advocate on my behalf if you're part of the majority. So that's kind of a little bit of my thoughts on this.
Mark, I think you hit the nail on the head. I had a chance just 10 days ago to go through the Birmingham Civil Rights Institute and travel to Montgomery and see the Legacy Museum there. And if anyone gets the chance to go to those cities in Alabama, it's a life-changing education to take your time through these historic places. But it is such a disgusting and awful history that exists in our country and has evolved over time, in especially I think out west here, to be to perpetuate systems that kind of keep the status quo. And it's uncomfortable for people, public servants who work in hospitals. I think you're public servants, first responders, the 3,000 people who work for Salt Lake City Corporation. Our people come to work because they want to serve their communities. That is such an altruistic and a beautiful place to anchor your work ethic. And it seems the polar opposite to say, guess what? What if there are systems that we are running here in government that are inadvertently perpetuating systems of oppression? That is antithetic to the heart of a public servant. And it's very difficult to, I think, create the space in your heart and in the culture of a organization to acknowledge that, to say that is possible, and then to be able to acknowledge the ways in which we can make change internally and for the people that we serve. But there's a real shift that I think has to happen, but we can't make it happen in people to recognize where we may be, unbeknownst to our day-to-day actions, perpetuating these systems of oppression. And that is a hard acknowledgement that as Americans, I think it's incumbent upon us to face and work with our community members and our friends and educators in this realm. I'll give a shout out to the Black clinicians who locally here in Utah are helping organizations like ours to have these hard conversations internally and educate our people, because they're coming to work for the right reasons, and we want to make sure that the way we work tomorrow is better than the way we did in the past.
I love what the two of you said. I have a bit of an advantage in that this clinical work that we're doing provides a safe space to actually have some of these conversations. And doesn't matter who you are, no one's going to want a brown baby to be more likely to die than a white baby, right? Nobody. There's not a human being out there who would find that okay. And then, as you say, as you unpack, where did that come from? How do we affect it? And you recognize that there are systematic problems. And I think one of the ones I would add to the list that you all shared is the digital divide is actually a huge problem right now, in terms of having people access information and be tied into solutions. I do think listening is actually a big part of developing understanding and creating a basis for conversation and common understanding. So I really admire what you're doing. We're just trying to do our small part at it. And every day that we recognize things like boy, we really can't get into one of these communities unless our community health workers look like the community and are ideally from the community. It broadens the conversation and helps people who maybe don't have experiences working with a diversity of people to get what it's going to take to get good, equitable clinical outcomes. And that does translate into different kinds of equitable outcomes as well, not just medical.
Dr. Harrison, let me add just a couple resources for those that may be listening in. You know, Pat
Thanks,
Jones
Russ.
and the Women's Leadership Institute has been working on these issues for years, right? And you have the scholarship of Dr. Glass and Dr. Matson at Utah State. And I guess what I would say as well is, you know, your workplace has been enhanced by tremendous women leaders in healthcare. And that inclusive piece, which didn't always exist, has made you a better system. And I think one of the challenges that I've heard is that, you know, mid-level management is where diversity and inclusion goes to die. Because if it's at the CEO level and they want it to happen, it is important to help those people that are doing it well to be recognized, right? So be sure to elevate them. Be sure to share best practices and successes, because I think some people also don't know what to do. And so because of that, they don't do anything. It's that, you know, hard inertia to start. But once you start saying, this is what one of the team leads did, that's a good thing. Anything else we can be doing, you're going to generate good ideas and positive reinforcement. But I'll also say it's also important to hold to have the expectation that this should be part of the work they do. And if they're not doing it as well as others, promote those that are doing it, you know, at a higher rate. Because if one of your core values is you're bringing people in and you're increasingly supervising more diversity within your communities, well, then how well are you managing that diverse workforce below you? Because it seems to me you need to do that in order to elevate into the company. And as the millennial cohort continues to come along, they're living this experience, right? The way we look at this topic is much different than the way our kids look at this topic and the interactions they have and the social networks they have. And so anyway, I just think that sharing best practices, sharing successes is another way to emphasize and bring to light things that can be done, and that helps move the conversation along, because it really takes, you know, many hands to do this work, and then no one has to push the big boulder. We can all push smaller boulders.
You're right, Ross. But you're also right. What the boss pays attention to, everyone else pays attention to. And there's a lot of intentionality around this. And if I hear one more time about the pipeline is empty, that's just lack of trying, to be quite honest, and lack of willingness to take a risk.
Yeah. Well,
when I arrived 5 years ago, the top 50 in the organization were 49 years old. They were 70% male, and they were 2% diverse. Now we're 46 years old, we're 50-50, and we're 25%. Now, is that perfect? No. My wife would say it should be 60-40 on the women to men, probably. But and I don't think, certainly our performance as a system has only improved, not, you know, it was always really good, but it's gotten stronger and stronger. And I don't know if it's because of that, but it sure hasn't hurt any. And it requires intentionality. And it's probably just enough said. So I think that we can't allow excuses to get in the way of doing the right things for people. I had the opportunity recently for somebody to ask me what my proudest moment as CEO of Intermountain Healthcare was. And since then, the pandemic has heated up again, and I'll probably say it's the work that our nurses and doctors are doing in our ICUs right now. It's absolutely remarkable. But on a one-by-one basis, I will say that my proudest moment has been when I was getting my blood drawn by one of our phlebotomists, as I have an opportunity to do on a regular basis. And she said to me, you know, Mark, I'm a gay woman. I've worked at Intermountain now for almost 30 years. And finally, I can bring my whole self to work. And And I was like, wow, that's deep stuff. That's big. And you multiply that by thousands of other people, and that's real societal good. So, I think that what the boss pays attention to does have an impact, for better or for worse, on the people who follow her or him.
Anyone want to follow on that? Because that's beautiful.
How can anyone follow on that?
Yeah, I will say that it really does speak to, though, those individuals from diverse communities being advocates for the place they work, right? This is the multiplier of having teams that represent all of the community, because they're reaching community differently. Let me ask another important question. I served in the Utah legislature, and one of the things we said is, what's important to you by where you invest your money. And so I'd like for you all to answer, how are your entities leveraging dollars, whether with hires or vendors or programs or community partners, but how are you making sure that your systems are inclusive economically in delivering, corrections to health outcome disparities?
I'll give it a start, and want to acknowledge that the federal dollars through the CARES Act and now with the American Rescue Plan, ARPA dollars, are a game-changing infusion of cash into communities. And we have taken it upon ourselves with our allocations to try to get as close to the community members who need those dollars and that support, as business owners and as residents, as we can. And we recognize right away that we lacked much of the relationship that Mark talked about. You don't get into the communities just walking from your desk at the top of the building down into the neighborhood and making those connections. We recognized how much more connected we needed to be. And instead of trying to make those relationships anew, we worked with community organizations who are on the ground and build partnerships there. So some of the ways we've invested are in grants to small businesses, where we've focused on trying to increase access and awareness of diverse business owners to these funds. We created an apprenticeship program, which we've never done in Salt Lake City Corporation. We have over 50 apprentices now, where we prioritized those apprentice opportunities for people who've been out of the workforce and are having a hard time reconnecting. You could think of all of the mothers in particular. I want to just mention again that Utah ranked 50th in the nation, yet again, just last week, for the status of women. And that is multiple measures, from women receiving promotions, holding elected office, holding positions of leadership, and pay inequity, gender pay inequity. We are the worst place in the nation, despite our strongest economy in the nation. We are the worst place for women. That needs to just sit with us for a while when we talk about investing in our people, and the proportions of people of color, and then the reality that half of our state is women. So we're investing in as directly as we can. We also grew our childcare opportunities. We run Youth City, which is a incredible full subsidized after school programming. We grew it to be during school because kids needed somewhere to go while their parents went to work and they were receiving school at home. And we've expanded also and have a new facility coming online to do more of childcare. And then increasing access to transit options, because the average household in Utah spends 20% of their income on their transportation costs, which is disappointing in a downtown capital city where we do have a lot of transit. We know we need more. We need those connections to be easier for our residents, to make it more affordable here. And so we've focused on our west-east connection bus service. We're paying UTA to run buses where we know our residents need those buses to be. And we're investing in building our public transit, not waiting for it to come to us. But I could go on and on about the investments we're making as a city, but this opportunity through the tragedy of the pandemic with these federal infusion of dollars is we've never seen it before, and our city council is about to consider about $35 million worth of strategic investment. So stay tuned. There's some big things coming in Salt Lake City.
Thank you. Connie, how about yourself?
Sure. I think one of our areas of focus is our technology. As Dr. Harrison said, there's that digital divide. But it's our technology as an organization, but it'll meet the needs of our customers. And what we do is we provide credit so for underserved and credit challenged individuals who may not be able to get those items they need. So we're looking at our technology and how we can provide better resources for them to get what they need to utilize what we have to offer them. So that's an area of focus. And then continuing to, recruit and keep. It's one thing to source and recruit for the talent, but then we've got to keep them. And so we're sending and we're utilizing a lot of resources and energy to do that. And now we're looking nationwide because the pandemic has changed and we realize we can work from home. So which has been beneficial because we can find talent throughout the country, which is also helping our diversity, equity, and inclusion initiatives as well, because we're recruiting from down south, back east, Midwest, all over the country. So that's beneficial, but it's one thing to get them and it's another thing to keep them, especially people that come here to Utah, of a diverse background. Do they want to stay? Do they see people that look like them? Do they get to eat the food that they might enjoy and had back home but can't find here? So I think that's a challenge we face for all of the organizations in Utah is, we're looking to get diverse talent and that's going to help us elevate our game. But then the challenge of keeping them here, making sure they feel comfortable and that they belong and that they can see somebody walking down the street that looks like them. I lived in Philadelphia for about 8 years and it took a while, but after a while I realized that, wow, I just kind of blend in because there's so much diversity. And I came back here, went to the grocery store one day, looked around and went, ruh-roh, I'm the only one, huh? So it's just, you see it and it's getting better, but that is a hindrance if people want to come to Utah to get them to stay. To really want to be here and really want to insert themselves into the community and really become a part, become a Utahn. So that's a challenge I think that we've got to address of being intentional on making sure people that don't look like everybody else or act like everybody else or whatever belong and know that there's a place for them and are welcomed and included and invited to be a part of the community, regardless of where they come from, their sexual orientation, their gender, any of that they just know, hey, this is a cool place to be. And I feel like I want to be here and I want to bring other people like me here because of how good of a place it is. So I think that's something we've definitely got to work toward, but we're moving in that direction.
Dr. Harrison, investments?
So they are wide and varied. We invest in hundreds of not-for-profits across the region, and we'd like to think that we make a difference for them. Some very specific things. We do invest in scholarships. We think that education and entry-level professional jobs are enormously powerful in terms of changing the trajectory of a family. Really, really important. As you may know, we've invested heavily in social determinants of health, and we've got a demonstration project that had two sites, one in Ogden, one in St. George. One was rural, one was urban, and looked at how addressing social determinants systematically changed health outcomes and health utilization. It's been wildly successful, and we're rolling that out into production across our enterprise. Things like school-based clinics we find to be really powerful ways of getting into communities. Same with community health workers. We've invested heavily, and we've actually helped the state hire community health workers so they could do some of that work along with us. Supplier diversity is actually a really important lever. We spend about $2.5 billion a year across the enterprise, and we've worked hard with local, rural, women-owned and minority businesses to try and make sure that they can get a piece of that pie and then advance their businesses in a very competitive, capitalistic in a great kind of way fashion. And to help with that, we also provide with some training so people can be successful with their RFPs, because they may have a great product but not know how to to access those resources because they don't know how to write the RFP. And then finally, we've done a lot around social impact investing. We're just getting started. Our board, at my urging now about 2.5 years ago, set aside a very large sum of money to invest in things that will provide a little bit of a return financially, but mostly provide social return. And to date, it's primarily been around affordable housing, which I now have two 20-somethings who are living here in our great city of Salt Lake. And man, it's hard for a kid to get started around here, find a place to live that they can afford. So we're feeling it at our house as well. And I can only imagine for people with far fewer resources, how terrible it must be. So Intermountain's trying to play a role in that. Look, people can't be healthy if they don't have a roof over their head, if they don't have food in their belly, if they don't have transportation, if they don't have physical security, and if they don't have a decent education. So we're trying to work. And given that we're oriented towards keeping people well, not just taking care of them when they're sick, this makes total sense. You know, our incentives are perfectly aligned to be as much of a help as we possibly can.
And I think, by the way, that's where healthcare is moving, right? We want to try to keep people healthy as opposed to treating an ailment, which is more costly and later.
From your lips to God's ears for us. Some days I'm more.
That's the effort and that's the goal. Dr. Harrison,
Yes,
could you just give us a 1-minute background on defining social determinants of health? So you've got a lot of tech community that may be listening to this and they may not be quite.
Yeah, no, it's the historically we've always thought about the things that contribute to health being hospitals and clinics and fancy medicines. It turns out that your environment, your genetics, and your behaviors play a huge role. And now I haven't figured out how to fix people's genetics yet, so we'll work on that over time. But you know, how clean is the air you breathe? How good is the food that you eat? Do you get some exercise? Have you experienced childhood trauma? Because that does actually affect long-term health. Can you make it to school? Because educational attainment is one of the most powerful, if not the most powerful, long-term determinant of whether you're going to be a healthy person as well as an economically successful person. So those are the things that are the social determinants of health. And the nice thing is you can work on all of them. You know, they are not impossible to address, but they do require teamwork. And I think that under the leadership of Mikkel Moore, our Chief Community Health Officer, who I think is one of the great healthcare leaders in the United States, I think we're getting better at being team players.
I agree. She is a asset for sure.
She's amazing.
Anyone else? We only have about 2 or 3 minutes, so maybe I'd give you each an opportunity for one last comment to share anything you might have forgot or give us, pearls of wisdom. Mayor.
I want to thank Dr. Harrison and Intermountain for the partnership that we've experienced at Salt Lake City with Intermountain and exploring how that through a collective approach we can address these social determinants of health. And you think about it, I'm a parent of 3, and that's the closest lens through which I can share that basically what stresses you out as a parent are some of those social determinants of health. What am I going to make for dinner? Is there food in my fridge? Do I have somebody to pick up the kids after school? If my kid gets sick, how am I still going to go to work so I don't lose my job? These are the things that we can have an impact on. And when we do, it's not far down the line where we see not only health impacts, but we see community health. We see stronger communities who can support and celebrate each other, and who end up attracting, as Connie was saying, more people to want to live in an environment like that. So these are multiplying effects. These are catalytic changes that we are exploring as partners and with a few other awesome partners in the state of Utah. How do we make these kind of strategic investments in communities that not only take some of the stress off of the shoulders of the residents here, but end up having a tremendous health benefit, economic benefit, educational benefits for the community as a whole. It's exciting. So I hope anybody who's listening into this and doesn't work in healthcare whatsoever, and maybe doesn't work for government, could say, I get how these investments are going to impact all of us for good, and that we might be able to find ways through philanthropic and just even volunteering and mentoring to do more good for these communities who simply haven't had it for too long.
Well said. Connie?
No, I think this conversation's been great. And I think the employers and representatives that are listening, we have a responsibility. The people spend more time with us than they do with their families. So as an employer, we have that responsibility to help provide and help guide and help educate. And we can do that. We really have an opportunity to help support our folks. And I loved, hearing the clarity from Dr. Harrison on those determinants and how we can help our people that are impacted by those issues. And so it's exciting, and we just have to, dig our heels in and get going on it. But I think it's a great opportunity for all these organizations that are part of the Silicon Slopes to really make an impact with their people, because we get them every day and we have access to them every day. So we can really provide some guidance and help, I think, for them.
Final comments, Dr. Harrison?
Yes, please. We are very grateful for the partnerships we have. We certainly could not get the things done that we want to get done in the absence of partnerships like with Mayor Mendenhall and many others. I'd say two other things. We should get to know each other. It's really difficult to dislike people once you get to know them. And I think that as we address some of these inequities, a lot of things are solved person by person based on relationships. Relationships really do count. If we do that, I absolutely firmly believe the best is yet to come. And I think together we can get there.
Well, let me just say thank you for all your time. Obviously, critical events going on, and the leadership you provide in the community and to the community is noted and appreciated, and your information and willingness to engage. Let me just, in a concluding way, encourage those from diverse communities that may be listening in, understand that Silicon Slopes wants our engagement. They want us to make sure we are conveying opportunities in this ecosystem and in our communities. And so there's a Silicon Slopes Summit coming up October 13th and 14th. Please look to gather there. They have purposely made sure there is tracks around diversity, equity, and inclusion. So these topics can be covered as well as others, right? We need to learn everything, but we do thank Amplify and Silicon Slopes for this time, and invite you to look in on us again. Thank you very much, everybody.
Thank you.